Welcome back, Dr. Rick Ross. Thanks so much for having me again. How are you doing today?
Good. I'm excited. Our first session was lots of fun, and we get to cover a lot of new content today.
Absolutely. I'm just going to hop right into it. So, I'm very curious about this Retain Your Brain software that you've been talking about recently on your socials. What exactly does that entail, and what does our viewers need to know about it?
So there are tens of millions of people out there that have Alzheimer's disease starting in their brains silently. And they don't have a doctor to go to. They don't have, resources or free tools. And what we did is we created what we call a virtual neurologist in your pocket. Basically, RetainYourBrain.com is a website that includes a platform that anyone can join for free today, where we can empower people to take control of their brain health. And, I started the first Alzheimer's prevention clinic in the United States back in 2013. And by the time I left, we had a waiting list of over 4.5 years, literally 4.5 years it took to get into the clinic to see a doctor. And that's just not okay. We aim to basically democratize access to brain health care. And if there's someone out there that wants to take control of their brain health, has a family member with Alzheimer's disease or other neurodegenerative dementia. I have 4 family members with Alzheimer's. We created RetainYourBrain.com, and we studied it. We were funded by the National Institutes of Health. We did an NIH-funded, randomized, controlled clinical trial. Those are fancy terms for basically a science-backed study that proved that if people use the Retain Your Brain software in our research study, they were able to lower their Alzheimer's risk by 6% in only 6 months. And it's all from the comfort of a person's cell phone. It's free. People can join today, do a risk assessment, learn about your risk factors, learn about so many things about brain health, little tools that they can use for their entire lives to promote cognitive health, brain health, and reduce risk of Alzheimer's and dementia.
That's amazing. And right now, only US citizens can download this, right? And they have to go onto their computer and just type in Retain Your Brain on Google.
Exactly. And RetainYourBrain.com or Retain Your Brain on Google or our socials or on, Instagram and all the fancy things. That I'm not on social media, but I don't know, Retain Your Brain is. So you can go on there, and yeah, RetainYourBrain.com is where to find it. It's not an app just yet. You can't go to the app store to download it just yet. Baby steps, we'll get there. But go to on your phone, type in RetainYourBrain.com on your whatever, or go on the computer, and you can join on your computer or your cell phone or a tablet.
Okay, amazing. Well, I'm just going to hop right into the questions. We have a ton of viewers who have submitted questions, and I'm going to go through them and you're going to answer them. So we are starting with number 1. So you've mentioned before that about 45% of dementia cases can actually be prevented. And we're wondering what the other 55% is up to. Why can't they do much to prevent their outcome?
That's a great question. I have actually never been asked this question before like this, so I'm glad we get to cover this. So 45% of cases may be prevented if that person does everything right, based on a number, about a dozen or so, of modifiable risk factors. So, managing hearing loss, exercise on a regular basis, managing risk factors like high blood pressure, high cholesterol, diabetes. These are things that can really, reduce our risk. The problem is there's a lot of people out there that may have other risk factors. For example, nutrition. So nutrition, the Mediterranean style diet, a recent study just came out showing that people with specific genes that put them at the highest risk of dementia can then cut their risk by 35% just by following a Mediterranean style diet. Green leafy vegetables, alcohol in moderation or not at all, fatty fish like lake trout, mackerel, herring, albacore, tuna, wild salmon, sardines. Nutrition, the Mediterranean style diet, has not yet been incorporated in this 45% number. So what I mean by this is in 2024, a big research study came out. The Lancet Commission came out and said that there are, a dozen risk factors that you can control. Nutrition wasn't included just yet. I think in the next iteration of the studies, it will. But by changing your diet plus 45%, you could probably easily maybe reduce dementia cases. Probably 50 to 52, 55% of dementia cases may be preventable if we also include diet. The challenge here is that evidence evolves every day, and that 45% statistic only includes evidence that was really, shown up until, strong evidence up until, say, 2024. So I think one part of the statistic is I would say inaccurate, because it estimates what percent of cases may be preventable. However, there's at least, I would say, a third, maybe 40% of cases that person can do everything right and they can still get Alzheimer's and dementia. Why is that? Well, there could be other genes that we don't know exactly what to do with just yet. There are some genes, a very small number of cases where if you get the gene, you get Alzheimer's disease. Those are early onset genes. I would say there's other, intangibles, intangibles. And what I mean by that is, some people have really strong genetic risk factors. They may not be able to exercise due to other physical limitations or something else. And there may be social risk factors. And the take home point here is, we can't defeat Alzheimer's right now 100%. We can't do that. And there are certain genes that, we can only have so much effect against. But for the vast majority of cases, genes are not our destiny. We can win the tug of war against our genes. And in those 30 or 40% of cases, if we can't definitively prevent dementia or Alzheimer's, what if we can delay it by 6 months or a year, 2 years or 5 years? And in that time, a new blockbuster drug comes, well, then in some ways, maybe we can prevent dementia in the vast majority of cases. But we want to be conservative, and unfortunately, we don't have all the answers just yet.
Okay, thank you very much. I think that was an excellent answer. Yeah, we don't have all the answers yet, but I mean, hopefully one day we will. And you're doing the good fight every day to get there. So I'm gonna hop onto our next question here. It's a general one. This viewer wants to know if you should take a daily vitamin, a multivitamin. Is that something you would recommend?
Great question. So, in the universe of things that a person can take, I think there are a few vitamins and supplements that may give certain people brain health benefits if they take them for a long period of time. What I would say is, there's no magic pill that can prevent or cure Alzheimer's disease. And individual people may or may not need different sets of vitamins or supplements. But the general recommendation I give to people is eat a balanced diet, eat a healthy diet. If people can eat a balanced and healthy diet, they're less likely to need, for example, a multivitamin. While there is some evidence to suggest that taking a multivitamin every day may potentially, in some people, may slow cognitive decline a little bit. It's not something, a multivitamin is not something that I tend to recommend to people on a regular basis. I think multivitamins, it depends also what's in them. Different multivitamins are going to be different than other multivitamins. How much B12 is in there? How much folic acid is in there? How many omega-3 fatty acids, brain healthy fats are in there, if any? Brain healthy vitamins, like, for example, vitamin D is probably a brain healthy a brain healthy vitamin. But the problem is, if someone has adequate levels of vitamin D, I'm not going to put them on a vitamin D supplement or vitamin because it already is normal. So the take home point here is, the one size fits all or one size fits most approach with Alzheimer's prevention and dementia prevention isn't really the best way to go about things. I really believe that. I don't just say, I'll go take some B vitamins or take some vitamin D. I say, if your B vitamin levels are low and another marker in your blood called homocysteine is high, it's a blood test that we can do simply, then those people that take B complex vitamins can slow brain shrinkage over time and improve memory. If someone has low vitamin D, even though they're getting some sun, between the hours of, say, 11 a.m. and 1 p.m., 10 to 15 minutes a day of sun is enough to kind of, ramp up some of the vitamin D stores, but other people are going to need to take a supplement. We check a level before we make a blanket recommendation just to take something. So in our practice, we don't generally recommend a multivitamin because we're going to hone in on what vitamin deficiencies that person may have, and then we address it. So when in doubt, talk to your doctor. We have software out there that kind of helps educate people about this. RetainYourBrain.com does an assessment about nutrition patterns and dietary patterns, and talks about supplements and vitamins and maybe who should be and who should maybe not be. And of course, don't start anything without getting approval and talking to your doctor. But yeah, multivitamins, not really top of the list in my Alzheimer's prevention plan.
Okay, interesting. And yes, go talk to your doctor, guys. A lot of these questions are very specific that I think a lot of people should be asking their doctors as well. But this is very, very nice to know. Another person asked, whether they should abstain from dairy. I assume that is also a pretty individualistic question to ask. But what would you say, Dr. Isaacson?
Yeah, so dairy's tricky. To me, dairy is packed with protein and nutrients, but the devil is in the details. So people for a long time said, "Oh, fat is bad. Full fat dairy is bad. Only drink skim milk." Well, I don't really agree with that. Skim milk takes out the fat, but it has more carbohydrates, more sugars. There's still a lot of protein in there, and that's good. But grass-fed milks, meaning cows that eat grass, have more nutrients than cows that eat grain. So that's why people, when you go to the grocery store, and granted, I see this every week when we buy milk, grass-fed milk is more expensive. But if a cow is eating grass and eating healthy, and there's fat in the milk, full fat milk from grass-fed cows or grass-fed cheese or grass-fed yogurt is packed with brain healthy fats in that milk. So I actually think that if the dairy is from the best possible sources out there, it's got great protein, it's got brain healthy fat, it's got some carbohydrates, okay, fine. But people need carbs, and that's okay. So I saw even a recent study, I think, that came across my desk that chocolate milk, lower sugar, not too much sugar, but even chocolate milk, full fat with lots of protein, can really provide some benefits. For example, after a workout, when we work out and we exercise, you need protein to build muscles, but you need carbohydrates to give the muscle energy so that the muscle doesn't break down too much during the exercise. So milk and chocolate milk are one of the great things that we recommend. Now, is dairy good? Is it bad? Are there other issues? Yeah, that's a complicated question and with lots of, nuance. But I would say on the whole, dairy can be a part of a very brain healthy lifestyle.
Okay, thank you. The chocolate milk argument is very interesting. On that note, would you recommend chocolate, dark chocolate in your diet?
Yeah, so for probably 15, 20 years now, and full disclosure, I love chocolate. I love dark chocolate. I used to drink one too many chocolate milkshakes, but I've tried to cut down. And now I have a couple a year. You got to indulge, and as my mom would say, everything in moderation. Chocolate in general, dark chocolate specifically, has been shown to have brain healthy effects. And let's again dive in, because the devil again is always in the details. If you look at a bar of chocolate, while I love Hershey's, and in some ways no shade on Hershey's, but in other ways shade on Hershey's, if you look at the Hershey's bar and you turn it over, there's like sugar and butter and more butter and then some chocolate, right? The Hershey's chocolate bar, again, I love Hershey's, so I don't want to say negative things, but as a treat, not as a nutrition element and not as something to protect and optimize brain health. Dark chocolate, the very pure dark chocolate, dark cocoa powder, for example. Not only has dark cocoa powder has been studied in multiple randomized studies. There's a brand that I use. I have no commercial relationships with this brand, but it's something that I use, the brand called Cocovia. It's made by Mars. I've been using this for 20 years. It's a dark cocoa powder that is purified and studied in multiple randomized controlled trials. Dark cocoa powder has been shown to improve blood pressure control. Wow, most people aren't aware of that. Dark chocolate powder, purified, has also been shown to help with insulin resistance, meaning insulin resistance is a problem that happens in diabetes and pre-diabetes when someone has lots of sugar and isn't exercising enough, and the insulin from the pancreas, it's a hormone, it keeps shooting out and it causes inflammation and accelerates brain aging. Well, dark cocoa powder has also shown beneficial effects for brain health and cognitive health and memory. And that's why I believe that the devil is in the details. Dark cocoa powder, I put it in my coffee every morning. Chocolate bars that have sugar and butter and more sugar and butter and then some chocolate, that's a treat, a sweet treat. That is not brain healthy. Are there dark chocolate bars that have 85% cocoa? And sure, but dark cocoa powder or pills, to me, has maybe, based on the evidence, the most medicinal effects.
Wow. So you put dark cocoa powder in your coffee every morning?
For over 20 years, yep.
That's incredible. I'm an avid coffee drinker. We all know this. It's not good. I drink it far too late in the day, like you've determined. Okay, I'm going to try that actually. I'll get back to you on that.
Yep. Now with dark cocoa powder, just a couple of caveats. So there is a little bit of caffeine there, and it sometimes can upset the stomach if you have it in high amounts. So I would always say start low, go slow. Use it earlier in the day. And when we're drinking coffee, coffee I think is very healthy. I have milk in it. I have dark chocolate powder. There's some protein. There's some taste. There's some antioxidant effects of the coffee, which has been shown to have positive brain effects. Stopping drinking caffeinated coffee after 12 or 1 p.m. in the afternoon is something that I would suggest, because caffeine has a half-life, meaning half of it is still around after 4 to 5 hours. So coffee, good. Dark chocolate, good. Earlier in the day, better.
Okay, you answered my question. Well, thank you very much for that one. Okay, well, the next one, and I'm doing these in order. So we've done what we're going to eat. Now we want to brush our teeth. And this viewer wants to know, is mouthwash good or bad?
Oh, is mouthwash good or bad? If you would have asked me this question a few years ago, I would have said, of course, mouthwash is good. It kills the bacteria and it makes your breath fresh, and it's good. And then I would say now, when I answer this question, I would say, oh boy, I'm going to sound like a broken record. The devil is in the details. There's mouthwash that has alcohol in it. There's mouthwash that doesn't have alcohol in it. And then there's mouthwash which is used by itself in combination with brushing, when once a day versus twice a day. There's so much nuance and so much confusion when it comes to mouthwash. Now, while I can't pretend to be an absolute expert in this area, and I am taught by colleagues, Ann Rice and others who have taught me a lot of this, what I would say is the following. Alcohol-related mouthwash may be less beneficial. It may actually dry out the mouth. It may kill off lots of bacteria, including the good bacteria and the bad bacteria. So I've actually personally cut back my use on alcohol-based mouthwash, and I've transitioned to different types of mouthwash that has no alcohol in it. And you can, read the label, and there's different types of ingredients. What I would say is, I'm going to sound like a broken record here again, talk to your dentist. Talking to your dentist, understanding what is the right cadence, meaning rhythm of how often to use mouthwash, how to brush, for example, using a regular toothbrush versus an electronic toothbrush. I actually have 2 electronic toothbrushes now, one that I travel with, which was a cheaper one that I have, and I bought it in the store, and I just travel with it. And then I have a regular brush that is my go-to brush that I use at home, which is the traditional electronic toothbrush that I believe is better. The key also with brushing and mouthwash and flossing is it needs to be done in a pattern, in a combination. You need regular dental cleanings. I actually get dental cleanings every 4 months. My insurance only covers it every 6 months. So once a year, I'm ending up paying for dental cleanings, because I like getting additional ones, because I think it's good for brain health. Inflammation in the mouth fast forwards inflammation in the brain, and that's not a good thing. We don't want inflammation in the brain, and that fast forwards brain aging and increases risk for dementia, cognitive decline, and Alzheimer's. So the question was about mouthwash, but it's not just about mouthwash. It's about having an oral hygiene routine that is approved by your dentist, and one that really focuses on the problems that you have. In my family history, we have a history of something called a gingivitis, as well as periodontitis. Those are big words, I believe, for gum disease. So I floss at least once, try to do it twice a day. It's hard. I have the picks. I have the regular floss. I do use mouthwash, non-alcohol based, twice a day, morning and night. And I also brush my teeth twice a day with an electronic toothbrush.
Okay. And then they want to know, they say you always say that there are no superfoods, but why are berries so important, especially compared to other foods?
Yeah, so good question. So, and I've said this before, superfoods, I don't know exactly what a superfood is. So whoever is asking that question has heard me blab away on one of these videos at some point, probably on RetainYourBrain.com, because we have like dozens and dozens, hundreds, over 100 hours of content about me blabbing away, as well as other videos and content and automated education. But, I don't know what the definition of a superfood is. I hear pomegranate is a superfood, and then there's pomegranate juice then gets interpreted as superfood. But then you look at the pomegranate juice on the label, and there's 40 or 50 grams of sugar, and that's not good, because that'll spike your blood sugar and fast forward brain aging, and that's just not good for belly fat and metabolism and diabetes risk and that kind of thing. So the devil is in the details when it comes to a superfood. There are antioxidants in things like pomegranates and blueberries, and the antioxidants are powerful, but I hesitate to use superfood because of some misinterpretation. That being said, if you have to box me in and you have to ask, I would say that berries, blueberries, and strawberries actually have the most evidence, but there's other evidence out there for raspberries and blackberries and things like that. In the Nurses' Health Study, which was published now over a decade ago, people that had a half a cup of blueberries or strawberries at least 2 to 3 times a week delayed cognitive decline by over 2 years. So that's not a drug, okay? That's something that you can eat. The good news about eating berries is when you eat some berries, the active ingredient, the thing that's protective on brain health, the anthocyanins or whatever antioxidant fancy word we want to use, lasts for several days. So you don't need to eat berries every day. You can eat it every 2 or 3 days. Berries are, here I go, I'm breaking what I said. In some ways, if you have to box me in, a superfood. You heard it here first.
Oh, this viewer got you there.
Got me.
No, I think you answered that very well. Yeah, superfoods is a very interesting concept to me too. And what you said about berries, I do need to eat more myself, I'll admit. Yes.
And berries are a great way. They're low glycemic, meaning it doesn't spike your blood sugar as much when you eat berries. So what we often tell people is instead of having a sweet treat, ice cream, other sweet stuff after dinner or for dessert, why don't you have a bowl of berries? And okay, fine. You want a little something sweeter, a little bit of whipped cream on top. Okay, fine. These are ways to lower your overall amount of sugars, processed foods, trans fats, all the bad stuff that's in ice cream. Sometimes you could really have a healthier version of a dessert by having berries and a little bit of whipped cream on the top.
And a little bit of cocoa powder.
Sprinkle on the cocoa powder. You can
sprinkle of cocoa powder. All right. So this is one that's obviously asked a lot, but it's more specific. This user is asking, does sleep consistency matter when it comes to working a 9 to 5 during weekdays, but then going over to the weekend and having a completely different sleep schedule?
Oh, great question. So, sleep is one of these challenging things that it's really hard to study, meaning to do a research project on the exact question that you're answering. I think in general, the thing that we try to advocate to patients and try to, I try to do it myself, but then, life gets in the way when you're off on the weekends. It's great to sleep late and it's great to stay up late because you don't have to be up the next day, but then you get off in terms of the consistency of having a regular bedtime and going to sleep at the same time every night or around the same time within 30 minutes or so of each other, and then waking up around the same time in the morning within, say, 30 minutes of each other. That's what we recommend, because when your body gets into a routine, your body then really has better sleep hygiene and better sleep efficiency. And if you can try to get at least 7+ hours a night, 7.5 even is better. That is really what we advocate to have better brain health. Now, the problem is that if you're getting 5.5 or 6 hours a night during the weekday, and you're doing that catch up of 8 hours a night on a Friday or Saturday night, does that really help? Does that really equate? And honestly, I don't think it does. I do think it's great to get extra sleep on the weekends if you can, but I don't think that sleeping an extra hour or two on the weekends is going to negate, all the harm and the, problematic, sleep that you have during the week. If someone is not sleeping sufficiently during the week, that's when the trash gets taken out. And that sticky protein, the amyloid protein, that's the protein that builds up in the brain of a person with Alzheimer's. When you exercise, for example, it loosens that protein up, but when you sleep, the trash gets taken out. And the challenge with those catch-ups on the weekends is it may catch you up for those 2 days, but I'd rather you have more regular sleep throughout the week. So I know that was probably an answer you probably weren't looking for, but making a plan for sleep is key. Prioritizing sleep is key. It's a really critical part of health. And yes, catch up on weekends, but don't sacrifice the weekday sleep periods because you're going to do some catch up.
And when it comes to sleep supplements, I know a lot of people use melatonin. And I've seen these on the market shelves for children, which was a very interesting here in America. That is absolutely not allowed where I'm from in South Africa. But would you recommend something like a melatonin, a supplement, if somebody struggles to fall asleep or maintain sleep?
Sure. So sleep is really complicated. And, the first thing we always say is talk to your doctor. People that are having trouble with sleep either falling asleep or staying asleep. Those are two different problems. They need two different plans. There are sleep specialists out there. If your regular doctor feels that a person out there needs a greater evaluation, falling asleep during the day, daytime sleepiness and snoring, for example, are two things that are very common. Those are symptoms that you can take all the melatonin in the world, but if you have a condition called sleep apnea, where when you sleep, your throat and you're snoring and you're not getting the air in, and it's called sleep apnea. Apnea basically is because your oxygen levels are down. You're depriving the brain of the oxygen that the brain needs to function well. And if you're stopping breathing for periods during sleep, because that's what sleep apnea is, just falling asleep more quickly, a few minutes more quickly with melatonin isn't going to fix that. So number one, figure out what exactly the sleep problem is. So if someone is having trouble falling asleep, well, why is that? Before opting for a supplement or a drug or anything, well, what about making a plan for sleep? Was your face, in the phones? Are you like this? So I got two phones and 3 phone numbers. That's I wouldn't recommend it. But 30 minutes before I go to bed, I silence my phones. So if someone calls me and I'm not expecting it, I'm going to be able to sleep through that. I also set an alarm on my phone, and actually RetainYourBrain.com, the software that I use to help with my brain health, actually sends me a reminder at 9:30 p.m. saying power off those devices. The routine or the brain healthy habit that the software gave me was put your electronics to bed, and that's what I tried to do. So if someone is all riled up before going to sleep on their phones, doing stimulating activity. Some people exercise at night and that kind of riles them up. Other people exercise at night and it doesn't bother them. A lot of people, for example, have been trying sauna at night to try to get them in a glass of warm milk. Okay, maybe that may work. That's what I've heard sometimes too. I'm not sure there's evidence there. Making the room dark, making the room quiet, making the room cool. Those are things that are called sleep hygiene techniques that are much, 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 much better of an idea rather than just taking a pill. If someone is doing everything right in terms of sleep hygiene and they talk to their doctor, melatonin is not something that I'm opposed to, low dose, although sometimes people can take melatonin and get some nightmares, and it's not really for everybody. And the take-home point here is you got to talk to your doctor. There's also magnesium supplements, magnesium threonate, magnesium glycinate. There's a bunch of different magnesium supplements out there that some of my patients have tried that does really help. But again, it really depends. Is someone making a plan for sleep? Are they waking up in the middle of the night? Sometimes, for example, men, they may wake up in the middle of the night because their prostates are enlarged. And that's not going to get better by taking a pill. It's going to get better by talking to your doctor and seeing, is there a treatment for a condition called BPH, or benign prostatic hypertrophy? So if men or women are waking up in the middle of the night, having trouble sleep, you have to make a targeted plan, a personalized plan for sleep. Although melatonin, magnesium, these are things that I think I definitely do recommend on occasion to patients after everything else has been evaluated well.
All right. Okay, I have 2 more targeted questions for sleep specifically. The one being lion's mane. Somebody mentioned that one. I've heard that quite a few times, so I'm asking it finally.
Sure. So lion's mane and I are not really, on the same page when it comes to being used as a brain healthy supplement. Here's the challenge. I think there's some very interesting evidence. Now, lion's mane is from a type of mushroom, and I think mushrooms can certainly have healthy benefits, general health, maybe potentially brain health. But some of the supplements I think out there are just a little bit all over the map in terms of what are the contents, what is the quality, what is the purity, what is the dose, how often do you need to take it? I've had a couple of patients. I've actually had 2. One patient that had lion's mane in a tea, and one that was taking capsules, and both of these people had changes in their blood, liver changes, and some other things that I believe were caused by capsules and pills and teas that were actually causing them harm rather than doing them much good. Is lion's mane helpful? Well, what type of lion's mane, what dose, what type? I don't think, to me, I'm ready to recommend lion's mane as a broad scale supplement that everyone should take. I kind of start with the basics, exercise, brain healthy nutrition, getting blood pressure, blood sugar, cholesterol under good control, doing all of the things, staying cognitively engaged. But if they're not doing all of those things, they're just going to try to take some lion's mane to think they're going to like prevent Alzheimer's or whatever. That's not something I'm there with. That being said, I reserve the right to change my opinion because ongoing studies may really give much more clarity and may allow us to really give more targeted, specific recommendations of which potential supplement to possibly use.
Of course. I mean, there are always new studies coming out. It's great that you are on top of it. And of course, we always reserve the right to change our opinion with new findings coming out every other week. Other than that, some people really like being on their phones until late at night. I know this isn't a good idea always because it overstimulates the brain. And they're asking if they could just add a blue light filter or even a red light filter. I know Brian Johnson, I don't know if you've heard about him. He recommends a red light filter. Is this something you would recommend to do? And could you explain the science behind that, perhaps?
Yeah, so blue light filters and the the blue blockers, I think that's a brand or something that's been out there ages ago. And I think there is some science to suggest that these types of blocking devices, blocking lenses that really filter out specific types of light can help the brain kind of get into kind of quieting down. I don't want to say hibernation mode, but basically getting ready for sleep. When you have all these devices that are like, blasting light and energy, there's something called the circadian rhythm. The circadian rhythm is something that is really critical to regulating the sleep-wake cycle. So when the sun is out during the day, the melatonin production is something that is suppressed, so you're awake. When the sun goes down, melatonin starts building up, and that triggers your brain to, hey brain, hey body, we better start getting ready for bed. It's a good idea to slow down and start getting some sleep. When those sleep-wake cycles are disturbed, it can cause all sorts of things get out of whack. I was actually watching a video online about some guy. He got like locked in some room for like a week or something, and like the lights were on for like a week, and this poor guy was like trapped in some room, and they made this poor guy like just like, I don't know, he had to like sleep with towels over his head. It was totally weird. I never watched videos online, but somehow this like came across my feed. Like, that's bad for the brain. Like, I wouldn't recommend that. That guy may need a brain transplant eventually, and we're running a special, buy one get one half off. Come to me, Dr. Rick Ross, brain transplant special, if you need one. But I wouldn't recommend that because too much bright light, whether it's from a phone, whatever, is bad on melatonin and it's bad for the brain. However, if we use those blue blockers or blue light this or blue, that may help a little bit, but it's not going to really cure the problem. There's like night shift or whatever it is on the iPhone. There's all these different things. To me, like what I do at night is I start dimming lights in my house. I start dimming lights in the room. It's okay to sleep with a nightlight, but sleeping in bright lights or really winding down should be done in a darker, dimmer place. So yes, I'm okay with or pro blue light blockers, sure, but it doesn't replace the fact that we need to make a plan for sleep.
And just quickly mentioning the circadian rhythms, if you're traveling a lot and you have jet lag, I assume that's not really great for your sleep health. Is there recommendations there? Would you maybe say that dimming the curtains at certain times or taking supplements then is more recommended, perhaps?
Yeah. Oh man, jet lag is the worst for the brain. Like, if you want to fast forward brain age, and people are going to hate that I say this because there are a lot of people that do these red eyes, and I used to do red eyes myself. Now I try to do anything I possibly can not to do a red eye because it just messes you up, not just for like the next day, but honestly, it could mess you up for days to come. Jet lag is tricky. There's a lot of different strategies for jet lag, and I don't pretend to be an expert in jet lag, but when it comes to jet lag, for me personally, I try to stay on my prior schedule for like as long as possible. That's just what works for me. I do believe that when I take melatonin at low doses, 1, 2, 3 milligrams, for example, to help me get to sleep when I'm in a new time zone, I think for me personally, that's something that's helped get me on a new schedule. I think the other thing is like when I get somewhere, I try to power through it and I try to exercise. Exercise to me after I land, if I fly to Europe and I'm all like discombobulated, the take home point here is I think everyone's a little bit different. I try to stay really well hydrated. I am traveling and I'm in airports, and you know what's bad in airports? Nutrition. There's like terrible food and, processed foods and packaged foods and all these things and sugars that like I get attracted to. I try to travel when I'm, going overseas with food that is healthier because I know I'm going to be like, in the airport, I'm going to be tired. I'm going to be starving. I'm going to be craving sugar. I try to, travel with protein bars and other nutrient dense snacks to make my jet lag better. The take home point here is everyone kind of needs to put their own plan together for jet lag. Talk to your doctor. And there's lots of information out there from sleep experts that can help.
All right. Okay, so let's go over to a different topic here. This user says stress. Does stress load on the brain depend on your age? In other words, is it okay to be more stressed when you're young or less stressed when you're older? Or is it just the same all around? Stress is bad. Full stop.
Yeah, well, stress is bad, but I think as a person ages, they may become more or less resilient to that stress. So, for example, sleep deprivation. When you're younger, you can recover, right? You're in college, you're studying, you're up all night. I used to, do this on more than one occasion. I had a big test. I basically study till 5 o'clock in the morning. I'd roll into class 7 o'clock, 7:30, take the test. It was all this, cramming, fresh information. I'd go to bed. I'd wake up at 2, 3 o'clock in the afternoon, and I'd be okay. On to the next day, moving right along. I cannot do that anymore. I stay up all night or I stay up late. It messes me up. So I think different types of stress affects the body differently. And, whether it's, work stress, life stress, personal stress, emotional stress, I think everyone has different, resiliency factors, weaknesses to stress, as well as, superpowers when it comes to stress. And there are some people that could, get up and talk to an audience of 1,000 people and it doesn't stress them out at all. Other people will be, their heart will be racing. They'll be sweating. They'll need to take the whole, the next day off to relax because they have, challenge with public speaking. So I think the take home with stress is individual people will respond differently to stress, and you need to just know yourself. I was wrong ages ago when I would say, mind over matter, just keep pushing, just keep going. You got to be stronger. It's fine. Just keep going, go. And that's wrong. And stress fast forwards brain aging. Rumination, worrying about the same thing over and over and over is the single type of stress that is actually the most injurious or the most harmful for brain aging and accelerates cognitive decline and brain cell loss. So the take home here again is, stress is bad. It's bad at all ages, but you're going to need to modify how you handle stress as we age.
Okay. And, speaking of superpowers, I have a few questions regarding ADHD or ADD, attention deficit hyperactive disorder. They want to know if that affects you differently under stress. And also, second tier to the question, does Adderall affect your brain health in the long run?
Sure. So I've gotten this question a lot over the last 10 or 12 years or so. And what I would say is there's nothing compelling from my perspective in terms of evidence that suggests that a person that has ADD or ADHD is more likely or at much higher risk of developing Alzheimer's disease or dementia. I haven't seen anything come across my desk that would say that. I also personally haven't seen anything very strongly compelling that medications used for ADD or ADHD, like stimulant medications, increase risk of Alzheimer's disease or neurodegenerative dementias. I haven't personally seen that. Will better studies be done? Will more research come out? Maybe that will change that talk track there. But to me, I haven't actually seen that. But what we have seen, and we published a paper on this around 8 or 9, maybe 10 years ago, was that people with ADD or ADHD or any other learning disabilities, like dyslexia, for example, those people, when they develop Alzheimer's disease, many decades later, in their 60s, 70s, or 80s, well, then those people present differently. Meaning, when you see a doctor, a person with Alzheimer's disease presents usually to a doctor, talks about short-term memory loss, forgetting appointments, losing their keys, trouble with everyday life. When a person then gets cognitive testing done, it has a pattern. it has a specific pattern that suggests that the person's cognitive troubles, short-term memory loss, and other things are related to Alzheimer's disease dementia. However, people with these other aspects, these other, what I would call neurodevelopmental diversity, their brains develop differently. And people with ADD, ADHD, dyslexia, all these things present or basically, look different than a typical Alzheimer's case. And we've written on this, and we call it atypical Alzheimer's. So they still have the disease Alzheimer's, but it looks different. When we do the cognitive testing, it's not the same pattern as you would expect. So I guess the nuance here is no, ADD doesn't increase risk, to my knowledge anyway, but it does change the way a person may manifest the disease of Alzheimer's if that person gets that later on.
Interesting. Yeah, that's very interesting. Yes, because people with ADHD often complain about completely forgetting what they were doing, getting distracted, losing their keys all the time. That doesn't mean they have dementia at the age of 22.
Yes. And one thing that's really important here is that, like I remember my nephew, we were out to dinner, and my nephew, he was texting under the table. I mean, it was clear he was texting. And we had this whole conversation, and we're like, oh, hey, what do you think about this? And he looked at us. He's like, what? Oh, I don't know. And like, you could think, the family or him, that's a memory problem, right? He didn't remember what we were talking about. No, that's not a memory problem. That's an attention problem. If someone is unable to pay attention to something, then that memory never gets kind of encoded or consolidated in the brain. The memory center in the brain is called the hippocampus. It's like a seahorse looking like shape in the temporal lobe deep inside the brain over here. And the take home point here is if you don't remember something because you weren't paying attention, it's not a memory problem, it's an attention problem. So if you pay attention more, then you can remember better. And that's one of the strategies that we use for people that are presenting with memory loss when it's actually an attention problem.
Very interesting. Okay, so we're going over now to brain fog, and specifically related to COVID. So somebody is asking if long-term COVID or brain fog associated with COVID, lingering brain fog, would that accelerate Alzheimer's? Is that a risk factor they have now developed?
Oh boy, how much time do we have to answer this question? This is, I need 2 hours. Okay. This is a complicated question to which we don't have perfect answers. Let me start by saying that. That being said, I initially was not clear that COVID really did anything negative to the brain because I had no evidence. There was no studies. The virus was new, whatever. Then this new paper came out a couple of years after the COVID-19 pandemic in 2020. It was like 2021, 2022, when a couple of papers came out that showed two things. One, in a group of people that had just gotten MRIs before the COVID pandemic, and then the same group of people got MRIs after the COVID pandemic, and they split it up to people that had, I think it was antibodies to COVID versus not. It was pretty clear in this one study that there was accelerated brain shrinkage and in the people that had COVID. So, wow, that was scary. That was like, okay, let me think about this. And I didn't want to get too worried about it. But is that COVID, the virus itself? Is that inflammation? Is that something else? Is that I don't know exactly. Is this just any virus that could do this, or COVID? So that's number one. Number two, another study showed that like people that had COVID infection early on, this is the alpha strain. This is like the original strain that was I think worse. There were people who used to lose their smell, get up in the brain, more inflammation, more brain badness. They had increased blood markers, proteins, including amyloid protein, and I think tau also. And those two studies showed me that, like, you know what, there is something to this with COVID and the brain. And then I started hearing about cases of brain fog, and that's real stuff. That's something that needed to be studied. So over the last just like year or two, our lab and our work has actually been focusing on this a little bit. And what we're finding is that anytime, which is crazy, but actually now, when people join our research study, instead of just getting blood drawn, we also do nasal swabs. We actually look for viruses. That person may have no symptoms, or they may have just recently had something. we actually look for the viruses, and we look for COVID. We look for rhinoviruses in there, which is a common cold, influenza. There's a lot of flu. The flu is very common. There's influenza 1, influenza 2. There's whatever. So the take home point here is that when we've seen multiple different viruses can increase brain proteins that are suggestive of Alzheimer's disease. And whoa, you say, whoa, that's scary. Herpes virus, for example, we had, brothers that came in and one had an active cold sore, which is a herpes lesion, herpes simplex 1, and their brain biomarkers, their tau levels were off the charts. So to me, what we do is now we're in the research phase where we're trying to figure out, is it COVID? Is it this virus? Is it all viruses? And I think there's something unique to COVID that does something funny with brain health, and we're actively studying that.
Very interesting. I mean, what scared me when I was younger, because I was talking with my doctor, and when you had COVID and you lost your sense of taste or smell, it's not that you can correct me if I'm wrong, but it's not that your tongue or your nose was harmed. It's the part of the brain that's responsible for actually taste and smell. It's quite literally the brain that was affected, which was very scary to me.
Yeah, it was scary so much that I kind of didn't believe it at first. I thought it was like hysteria. But then you say, wait a minute, then the nose, okay, virus, okay, the brain, oh wait, the smell part of the brain is like exactly where the virus can get to most easily, behind like where the nose sits. And wow, there's something to this. And then we started doing smell tests on people, because we do, doing an odor identification test, scratch and sniff test. We do this on everybody. That can increase, if you have low smell or you have problems with smell, that increases your risk of Parkinson's, Alzheimer's, a whole variety of things. And we were seeing this time and time again in people with COVID. So, yep, it's something that's real, and we got to figure it out.
Geez. Okay, let's go on to the next one then. So, there's a lot of confusion regarding statins. And do you recommend them for people with elevated cholesterol?
Great question. So there are a small number of people out there that when they get prescribed statin drugs, statins are drugs that are used for cholesterol, and they've been around for decades, that report some sort of brain fog or some sort of funny things with their cognitive function. You can also get muscle side effects, things like that. I think in my clinical experience, the vast majority of people that take statins or most cholesterol drugs tolerate them well, and their cholesterol comes down, and their risk for cardiovascular disease, vascular cognitive decline, or dementia, come down. I think the challenge here is that, there are some people that don't behave this way. And, what our research is doing is we're trying to figure out which of those people, is it because they have one or more copies of a specific gene? Is it because the dose of the statin is too high and it's lowering the brain protective, if there's one type of brain healthy cholesterol out there, and we can talk about this nostril, we can talk about this other thing. Our lab, we're actually trying to figure out, and I think we may have the right target, but we're actually developing a blood test to try to figure out whether or not a person who may be at risk of a statin side effect that isn't a fun one, maybe we do a blood test first. And if it's positive, or if it's this, or if it's that, maybe that person should be on something else aside from a statin, because there's other drugs. But I would say, the work we're doing in this sense, allslabs.org, if you want to learn more about information, we're trying to democratize access to, trying to develop the cholesterol test for the brain, which is not really a cholesterol test, but it looks at a variety of other markers before symptoms. And as part of this cholesterol test for the brain, we're actually looking at a marker of brain cholesterol in addition to amyloids and taus and other things that put together in this formula that we're creating. So what I would say is, on the grand scheme of things, statins have been very, very, very beneficial for the majority of people that take them. But I would also say there is some nuance here, and the devil is in the details.
Okay, thank you very much for that one. Now, something that's very interesting here is the prevalence of dementia increasing once you have hearing loss. And a lot of people want to know how seriously they should take this at a younger age if they're already experiencing hearing loss, if tinnitus has any correlation there. Second tier question there for you. Yeah.
So this is one of those things that I've really learned in the last 4 or 5 years, because, a decade or 15 years ago, I saw my first Alzheimer's prevention patient back in 2009. And that's 16 or so years ago. I wasn't asking about were they having hearing trouble. I wasn't telling anyone age 50 and above to get a hearing screen every year. And that was really what I believe a missed opportunity. And about 5, 6 years ago, really all of my patients, I started asking, hey, do you have any hearing trouble? Go like this, go like this. Can you hear that? If you couldn't, definitely 45 and up, we would, tell someone to get a screen. I think everyone at age 50 and above should get a screen. I think people that, get a hearing screen and then find out that they would benefit from hearing aids. A lot of people have no interest in wearing hearing aids, and I get it. They're fumbly, they're hard, there's echoes, there's clicking, there's clacking. But there's better hearing aids now than there used to be, and the cost has come down quite a bit. So hearing loss, believe it or not, based on the 2024 Lancet Commission, that report that showed that 45% of dementia cases may be preventable if that person does everything right, the number one risk factor that in terms of magnitude of effect is 8 or 9% of dementia risk comes from hearing loss, and hearing loss is something that can be treatable. And in order to treat it, you need to recognize it first, hearing screen, see an audiologist, get a hearing screen, talk to your doctor. There's actually hearing tests that you can do online, for free. And if there's a problem, get fitted for a hearing aid, or there are now even over-the-counter hearing aids. So definitely something we need to hit. When it comes to tinnitus or tinnitus, that's tricky. That to me, tinnitus or tinnitus, I'm not even sure how to pronounce that, is basically someone that has ringing in the ears, and the ringing in the ears can be caused from a whole variety of things, from vascular issues to damage to loud sounds to all sorts of different things. So I'm not really clear about the relationships between that ringing in the ears and risk of dementia. And there may be a slightly higher risk because of trouble with interpreting stimuli, and when someone can't hear, they or shies away from conversation, they're less likely to be socially engaged. They really withdraw from things. They're not able to stay engaged, mentally stimulating, cognitively stimulating activities. So to me, hearing loss is one of the most critical low-hanging fruits in our fight against dementia.
Makes sense. Okay, THC gummies. Good or bad for the brain?
What flavor?
Berry.
Berry. Well, berry. Okay. Well, if they're berry, then they have to be good for you, right? So, okay, THC is not something that I would say is protective on brain health. THC is not also something that I would say is like clearly harmful. Just depends on like the dose, the frequency. Is someone doing this occasionally at a lower dose recreationally? Maybe it's okay and it doesn't really harm. I don't think THC is like protective. There's another component of cannabis called CBD, cannabidiol, something like that. CBD may potentially, I'm not really sure, may potentially have a little bit of some protective effects, or be neutral, have no effect, or who knows, it could be harmful, but we don't really have the perfect evidence. I think THC and gummies, it's hard because, number one, gummies have lots of sugar, so that's a whole different discussion. They could be berry flavored, and they're probably not going to have the antioxidants in them. But, I think the jury is still out a little bit, and I think it also depends on, is someone taking them right before bed? Is it interfering with adequate sleep? Is it causing what's called sleep architecture to change, where someone's not able to be as rested or really able to get into deep sleep, or REM sleep, which is like the deep sleep is when the trash gets taken out, and REM sleep is when the short-term memories go into long-term memories, called memory consolidation. That's also when people dream. So if THC or CBD are affecting those sleep patterns in a negative way, then that's not something we want. So I would say the jury is still out a little bit.
Okay. So this question is based off a pretty viral incident that happened recently, where a WWE wrestler had a concussion, and then he went on to fight again, and there was some altercation. He was knocked out cold and got like 20 punches to the head while he was unconscious. Now, this is very bad, right? You would probably recommend not doing that.
Yeah, so traumatic brain injury, or TBI, is something that absolutely increases risk of cognitive decline and dementia. Boxers, for example, they get something called dementia pugilistica, and pugilistica, I think, is Latin or some language for getting punched in the head multiple times over and over, and getting multiple small as well as larger concussions that cause a lot of negative effects over time on the brain. Whether you are playing football and you get your bell rung and you kind of like are dazed, and then you get sent back to the field, those days are kind of over. There's now testing that is done on the side of the field that basically allows the doctor on the field or the medical professional in the field to know that the person may be having a concussion, these little multiple concussions, even if a person does not lose consciousness. But if there's an alteration of consciousness, that person needs to give themselves time for recovery. Post-concussive syndrome is a constellation of signs. When someone has a concussion, they may be slower, they may be dizzy, they may have ringing in the ears, they may get headaches, they may be nauseous. You really got to wait a defined period of time till that person is feeling better. And it could take hours, it could take days, it could take weeks for that to heal. And otherwise, these multiple concussions are bad. Now, when a person has a concussion or traumatic brain injury and that person loses consciousness, that's the worst. Now, whether it's for a few seconds, okay, that's one thing, and that's not good either. But a few minutes or longer, that's really bad. So, when someone has an injury, a concussion, and then gets, pummeled in the head a whole bunch of times without sufficient time to recover, that's not good. So the take home point here is, wear a helmet while biking. That's key. Wear a seatbelt in the car, because a concussion, you could slam your head. If there's an accident, you can slam your head on the seat, and you may survive if you're not thrown out the window. Okay, great, you're alive. But if you hit the windshield, or if you hit the seat, if you're sitting in the back, wear your seatbelt. One of the most critical early life things that a person can do as they're growing up is to wear a helmet. When I see kids around my neighborhood on scooters or on bikes, without wearing a helmet, it's the neurologist in me. I stop them. I'm that guy. I'm that dad. That I'm that guy, and that's what I'm known for. And guess what? Most kids in the neighborhood now wear their helmets because I'm that guy, and I think they'll thank me for it later. I think taking concussions seriously, and there's something called CTE, chronic traumatic encephalopathy, which is seen in football players and people with contact sports. There's other things like something called ALS, or Lou Gehrig's disease, which is amyotrophic lateral sclerosis, also increased in athletes that have head trauma. There's so much nuance, and there's so much difficulty with recovery from these things, that it's really important if someone has a concussion or multiple concussions, see a doctor, a brain injury specialist, and please protect your head.
Does even one concussion have a potential forever effect? Some users have fallen recently. The one went skiing, so he's specifically asking if he's now doomed.
Yeah, so I think it depends on the severity. So, one concussion for, get your bell rung a few minutes here and there, and then a few hours later you're back to normal, and, you don't have months and months and months of symptoms. I think that's one thing. I think also, is the person taking care of themselves? Are they well hydrated? I think the other thing here, devil's in the details. I've said this a few times. What if a person has a specific gene or genetic combination that puts them at higher risk of developing cognitive decline or dementia or Alzheimer's related to multiple concussions? So, just like there are some people that can smoke cigarettes and never get lung cancer, there are some people that can have one or two concussions, or 3 or 5, and they're not going to develop cognitive decline because they have a more favorable set of genes. However, there could be people with certain genes that could have 2 concussions, and that could increase their risk of dementia quite a bit.
Speaking of genes, somebody wants to know if you have more or less a percentage of people who have both APOE4 genes, if they have 2 of them, more or less, what is the percentage of that population group developing dementia eventually?
Yeah, so I think too many people out there think that if you have 2 copies of the APOE4 variant of the APOE gene, and that was a lot of words, but to explain what is APOE, APOE is a gene. You get one from mom and one from dad. And which one do you get? You get a number, a 2, a 3, or a 4 from mom, and a 2, or 3, or a 4 from dad. So everyone out there has 2 copies of APOE. Some people are APOE3, APOE3. That's the most common neutral risk. 55% of the population has 2 copies of E3s. There are some people out there, a lot of people, 25% of the population, believe it or not, have at least 1 copy. So for example, they have APOE3 and APOE4. So 1 copy of APOE4. And those people increase their risk a little bit of Alzheimer's. Some studies show threefold, 5-fold. The numbers are all over the map. But if a person changes their lifestyle, changes their behavior, and modifies their medical risk factors, I believe that most of that negative impact of those genes can be neutralized. I really believe that. Now, there's about 1% up to 2% of people that have 2 copies of ApoE4. So mom gave that person an ApoE4 and dad gave that person ApoE4. About 1 to 2% of the population has that. I really believe that genes are not our destiny. We can win the tug of war against our genes. And a recent study showed that just by following the Mediterranean style diet, people with 2 copies of the ApoE4 variant reduce their risk of of dementia, of which the most common form of dementia is Alzheimer's, 60 to 70% of the time, by 35%. So people out there say, oh, I got 2 genes, I'm doomed. Well, no, follow the Mediterranean style diet. Works the best for your genes. And actually, if you really follow it even more closely, it's your risk reduction from eating a Mediterranean style diet is even more than 35%. That was just in the first category. So if you exercise on a regular basis, you have perfect control of your blood pressure, your cholesterol, your blood sugar. You wear a helmet, don't have head trauma. You stay engaged with life, cognitively stimulating activities. You have sufficient brain healthy fats, omega-3 fatty acids called DHA and EPA, wild salmon, lake trout, sardines. Sometimes people take supplements if the doctor says okay. Vitamin D, adequate levels of vitamin D, especially important. Omega-3 fatty acids, brain healthy fats, and vitamin D are especially important for people with 2 copies of ApoE4. What about smoking? Very bad for people with 2 copies of ApoE4. What about alcohol? Very bad with 2 copies of ApoE4. So if you know your genes, and if you have 2 copies of ApoE4, while some studies show 8 times risk of Alzheimer's, 10 times risk of Alzheimer's, those studies are not you. Those studies are aggregated over data over decades where we didn't have this information that we could change our behavior, change what we do everyday life, and reduce our risk. So to me, I believe that it's impossible to say, oh, I have 2 copies of ApoE4, I'm at 5-fold risk or 10-fold risk. No, you're at however higher risk you are based on your lifestyle choices in combination with your genes. And that's why, I think genes are not our destiny.
Okay. Well, I think that's an excellent note, actually, to potentially end off this session of Q&As. Thank you very much, Dr. Isaacson, for having me once again.
Of course. And actually, I have one question that I promised I would get answered from one of our Retain Your Brain users. So can we talk about this one final one?
Extra
in our final couple
bonus content. Yes, please.
Extra bonus. Is this what this is called? Bonus content?
It's bonus content.
This is only my second YouTube video that I've done specifically for YouTube. So okay, bonus content on the second video. This is cool. Okay. I have a woman who is asking me and asking our support hotline on Retain Your Brain about hormone replacement therapy. And the woman learned about her risk as a woman being higher. 2 out of every 3 brains affected by Alzheimer's are women's brains. And we talk about this in the software and we try to explain in the software about why we think this is. And, we've done a decade of research on women's brains and why. And the question that the user asked was, is hormone replacement therapy, is estrogen protective? This woman went to their doctor. She's just starting to have some symptoms related to perimenopause where she's, having some night sweats, maybe a little bit of brain fog, just not really feeling herself. And she went to her doctor and her doctor said that no, she doesn't need hormone replacement therapy. Change the temperature in the room and, the brain fog is fine. You just are probably not sleeping well and maybe take some melatonin. So that's the question. So Tia, what do you think from what you've learned about hormones and brain health? And then, what do you think here?
Geez, Dr. Isaacson, I think it's all in her head. I think she's imagining it. I think she should just ignore all of that and go about her day like nothing is wrong. But if I were to think about it a little longer, I think she should consider some hormone replacement therapy. I think that might be a very valid idea.
Yep. So I know you said that jokingly, and
yes, I did.
That you did, because as a doctor, I don't know if I want to say I was taught this, but I think whatever bias there is in gender-based, education and whatever, 20 years ago or 25 years ago, that's what I thought too, because that's what doctors tended to think. Brain fog during menopause, oh, that's all in your head. Symptoms of sweating at night, okay, change the temperature in your room. It is preposterous that the medical field got this entirely wrong. perimenopause is, in my view, a brain disease. So when this user sent in this question, that they actually went to their doctor, and their doctor still in 2025 is still saying that you'll be fine. I think the medical system and education out there has to do something, and has to do a better job, because when estrogen drops suddenly during the perimenopause transition, now especially in women with one or more copies of that ApoE4 variant of the ApoE4 gene, in our research we showed that when that estrogen drops, that's when the bad proteins start accumulating, that amyloid protein. And in women that took hormone replacement therapy, in our brain imaging studies, those women's brains looked the best out of any women's brains that we studied over the 18-month period that we looked pre versus post. The women's on HRT, hormone replacement therapy, estrogen, and or progesterone did the best. So what I would say to this user out there is, this is not in your head. This is real. Honestly, perimenopause in some ways just as much of a brain disease, a brain condition, a brain issue, as it is a female issue, a GYN issue. So there has to be a GYN out there, a women's brain health expert, a preventative medicine minded primary care doctor that understands this. So what I would say is, get another opinion. Go see a specialist. Go see someone that is well versed in hormone replacement therapy. And the choice is different. Now, there was a recent study that just came out, like literally, showing that depending on which type of hormone replacement therapy you get, for example, a patch or a pill, there's actually differential beneficial effects on cognitive function. We, in our clinical practice, and again, this is in combination, we talk to the GYN, we talk to the primary care doctor, I'm the neurologist, we generally suggest transdermal, meaning a patch, bioidentical, meaning the same stuff that your body produces, not the olden days studies, which a lot of the hormones came from, believe it or not, purified horse urine, which is crazy. But basically using a patch and using oral progesterone in certain women, for example, women that have a uterus, we have to be careful and may have to do ultrasounds. So the take home point here is, women in the perimenopause transition, this is a critical window of opportunity. So for that user out there, I think you were given information or misinformation based on science and data and teachings from 20 or 25 years ago. I think today we have sufficient evidence that if there are, obviously there's risk versus benefits with everything. We don't want to just say every woman needs to go on hormone replacement therapy, go. But I really believe that estrogen can be, have powerful effects. It has to be at the right dose, for the right duration. Things have to be tracked. We track estrogen, we track progesterone, we track brain health markers, amyloid and tau. And I think the take-home point here is that hormone replacement therapy has to be part of the conversation of a person, of a woman that is at high risk of Alzheimer's disease.
Wow. Best bonus content ever. Thank you so much for addressing that. Yes, I have a lot of female friends, and it is certainly something that is still very often overlooked. And I think even I am incredibly grateful that you are discussing this. So thank you very much for that answer.
Absolutely. And Tia, thank you so much. Really amazing moderation. And I appreciate the questions, some of the hard ones, a couple of hard questions today, but hopefully I held my own.
You did. I think you answered them very well. Well, thank you everybody for tuning in today. There will be another episode out very soon. You can just subscribe on YouTube. You'll see the notifications pop up. And if you haven't yet, try RetainYourBrain.com. It is a software that is developed just for you, and it's getting better every single day. We're adding more content. Thank you guys.
Thank you so much.